I'm Louise Bradley, and I am the President and CEO of the Mental Health Commission of Canada. Having been a nurse for a very long time, there are a lot of learnings that I have taken from being a nurse to being in a leadership position. It's only been recently that I have started to share my own struggles with mental illness. And I thought, my God, Louise, if you're head of the Mental Health Commission of Canada and you're having struggles, imagine what a frontline nurse in a hospital is experiencing. I would really strongly urge that, particularly nurses who are in leadership roles, if you can, on some level, share some of your own stories. It allows others to have the freedom to talk, because hiding how you're feeling and how you're dealing with things does not allow you to feel good about yourself. But equally as important, and I know nurses value this, is that it doesn't allow you to be the best kind of nurse that you need to be. The care that you give is impacted if you aren't looking after your own mental health. And so that's why it's really important to be able to know when you need help, but more importantly, to reach out for help. Mental Health First Aid is a course that allows you to identify problems and what to do about them in other people. The Working Mind is an assessment of your own mental health. It is not a program that pathologizes any of the feelings that you're having, but builds on resiliency. So I think it's really important to take these courses to be able to build your own resiliency, and also to help the nurses around you, and particularly those of you who are in leadership roles. I really wish I had just a very concise list of things to do and tips to follow. Unfortunately, it's a little more complex than that. Because we have been trained and educated to think that we're the caregiver, we're not the care receiver, it's really hard sometimes to switch those roles. And I can't tell you how intertwined they are. I think that expressing one's vulnerability is actually displaying strength. And because of the stigma, we come to believe that we have to be superheroes all the time. But there are a lot of people with mental health problems that expressing that vulnerability is actually a strength, and I'm a living example of that. I think it's important that when I talk about vulnerability and sharing our own stories, that you're probably wondering, okay, what is the story that you're referring to? My first experience with the mental health system was when I was 12 years old. And I found myself hospitalized for several weeks under the care of a child psychiatrist. And that came after having been in as many foster homes as that in about 5 years. So that has a tendency to play havoc with your mental health. Fast forward to 1991, my very best friend of many years died by suicide. And that impacted me in a way that to this day, I find difficult to express. I ended up in therapy. It was the most difficult thing I had ever done. I've come to learn and accept it's perfectly okay that every now and then I need a booster shot. Does the black dog come back and visit every now and then? Yeah, afraid he does. But I now know how to stave off a full visit. And that's an accomplishment that I'm very proud of.